لا ده من تليفوني يا دكتور عمرو. تمام.
هو المفروض كده. تمام
تمام.
كده.
م.
تمام، أنا جاهز يا دكتورة منى.
طيب يلا بينا.
تمام. Good morning. I'm Dr. Amr Ashraf, one of the medical doctor here. I would like to confirm you are Mr. Ahmed.
Yes.
How are you feeling today, Mr. Ahmed?
I'm not feeling well, doctor. These breathlessness, fever, feeling fatigued all the time. I'm not feeling well.
Well, I'm so sorry for that, Mr. Ahmed. I am here to discuss with you your medical condition and address any of your concern. So, could you please tell me what do you know about your condition so far?
I've been suffering from bugs in my chest. And despite being admitted for the last week, actually, I feel myself more worse. I didn't feel any improvement. On contrary, this breathlessness is worsening, and I'm feeling much worse.
Well, I'm so sorry to hear that, Mr. Ahmed. So, do you have any expectations from our meeting today?
I'm expecting that you find a solution for my condition to improve my symptoms.
Well, I will do my best to do that, Mr. Ahmed. You have a very good idea about your condition so far, but let me explain to you more. As you said, Mr. Ahmed, you have been admitted to the hospital because you have bugs in your chest, and these bugs has led to severe inflammation actually in your chest, and you are starting. Your condition is starting to become more and more severe in the way that our consultant has decided you should be admitted to the ICU. Are you okay with that, Mr. Ahmed?
Oh, your colleague told me about this, doctor, and actually, I cannot be admitted to the intensive care. Um, I cannot, I refuse this admission. I like if you find another solution rather than admission.
Can you tell me, please, why don't you want to be admitted to the ICU?
Oh, my wife was admitted in the intensive care and she died after that. I know how people feel when they are admitted in this cold room, when they suffer while the beloved one are away from them and then die alone. I don't want to have the same fate. If I'm going to die, I prefer to die within beloved one
Oh,
beside me.
I'm so sorry for your loss, Mr. Ahmed. Um, but let me tell you more about this. Uh, there is some kind of medical support that cannot be provided in the medical ward, and if you are in the ICU, I know it is too hard for you to be isolated from your beloved one, and they will not be able to visit you like usual. But your condition require us to put you in this place to be in close monitoring and to give you some medication and to support your respiration with our medical staff and medical equipment in order that your condition can improve and we hope that you will be safe and sound and you will go out from the ICU. So, are you okay with that, Mr. Ahmed?
No, I'm not okay. I know that people who reach their condition reach the extent they require intensive care admission, they usually don't survive. And if I'm going to
Well,
die, I accept to die, but not in the intensive care. And I don't want to use any machine.
okay, I appreciate your concern, Mr. Ahmed, and I know this could be hard for you, but not all of the people that go to the ICU are in critical condition or in or they are going to die. Uh, I'm sorry, they are in critical condition, but some people make it out from the ICU, because we are putting patient in the ICU, so that they are in close monitoring, okay, and they are taking the best treatment available for their condition. And in your case, Mr. Ahmed, your chest has been affected so badly in order that uh, you cannot be stay in the ward and guarantee that your chest will not be affected anymore. That's why we need to put you in this ICU, so you could benefit from the extra care there. And if you don't want to be put in machine, um, we shall not talk about this right now. We just need to talk about if you want to be admitted to the ICU or not, and if you agree or that we can consider the need for machine or not in there. And it is your right to accept or refuse, but we are just trying to do the best of interest for you, Mr. So what is your opinion?
You mean if I'm going to be admitted to the intensive care, you are not going to put me on this machine?
I will discuss you if we are going to put you on a machine. We are going to discuss you the pros and cons of this machine, and the medical decision will be taken according to your acceptance or refusal. We are not going to force you to do anything, Mr. Ahmed. It will be up to you.
So if we don't need this machine, why don't continue treating me on the ward?
The ICU is not just about the machine. It is about the care we provide in the ICU. There is some sort of care that we cannot provide in the world. We need to put you on some specific machines, not that support your chest, but like to monitor your blood pressure regularly and your oxygen in your blood regularly. That's why you will be in a close monitoring for this. And unfortunately, we cannot do this in a medical ward.
Mm. So what if I refuse intensive care admission?
It will be up to you, Mr. Ahmed, and I will give you some time to think about this. And if you want, I can schedule another appointment with this, schedule an appointment with the consultant in charge.
Okay.
Do you have any concern, Mr. Ahmed?
I'm just concerned about my condition and if there any other option than intensive care admission. If I refused, what is going to happen?
Okay, regarding your condition, Mr. Ahmed, you have been admitted to the hospital with chest bugs, and unfortunately, the infection is going more and more progressive in the way that your oxygen in your blood is not very good, and your condition is so badly affected in the way that you shouldn't be in a medical ward. We need to put you in ICU, and unfortunately, if you refuse to go to the ICU, we will continue to give you our best care, but some sort of care can't be provided in the ICU. And I'm afraid that your condition might need some respiratory support, like we might need to put you in mechanical ventilation. Uh, this is a machine that can do the work of breathing for
Oh,
you. And I'm so sorry. I know it could be so harsh to say that, but if you refuse to do the ICU and we are not going to provide you more intensive care, I'm afraid that your condition could deteriorate more, and you might not make it, Mr. Ahmed.
mm,
We are and regarding our management, we will continue to give you our best support and our best care that could be provided in the medical ward.
mm. Okay, doctor,
Any
thank
other
you.
concern, Mr. Ahmed?
No, thank you.
I would like to ask you, what is your idea about the machines that you don't want to be connected to?
What I know that my wife was connected to this machine and she died after this.
Do you know
Uh,
respiratory support
time
machine,
finished.
mechanical ventilation?
Thank you.
Excuse me?
Time finished. Time finished.
تمام
Thank you.
تمام تمام.
طيب
Thank
كويس
you.
يا دكتور عمرو بس let's say what are the important points that you should raise and what are the important points that you should avoid in such scenario. طبعا very important to be empathetic in such scenario. The patient has previous hard experience which is the death of his wife and he is refusing mandatory treatment because of his bad experience. So very important to be empathetic and show or acknowledge bereavement. Uh, then you have to clearly explain the medical conditions that he is passing through and why we need to admit him to the intensive care and explain to him what is the drawback of not being admitted to the intensive care. Don't use abbreviation. يعني don't mention ICU إلا except if you mentioned at the beginning intensive care unit or ICU. يعني if you are going to mention abbreviation, you have to identify it at the beginning of your conversation. Very important in this scenario to assess the patient capacity. يعني this scenario is made to test two important ethical issues. Autonomy, which is the patient right to take decisions, so you shouldn't enforce the patient to take one way or certain decision. And you should appreciate his opinion, whatever, even if it is contradictory to what you decided or what you want to do. But before this, you have to assess his capacity, which is the ability to receive, retain, and recall the information and take decision based on balancing the benefit and risks. So here, very important to assess the patient capacity and clearly explain that you are respecting his autonomy. If we run this scenario again, very important not to push the patient, not to frighten him, and to be empathetic in such scenario, and try to يعني demonstrate why it is important to admit him in the ICU. So after greeting, good morning, I'm doctor, and mention your name. I'm one of the doctor taking care after you. Um, you can have any start statement like, for example, I understand things have been going quite overwhelming today. Would it be okay for you to talk about what is happening and what is the next step in treatment? Or we are here today to discuss about the progress of your medical condition. Is it okay with you? Before we go further, would you tell me how much you know about your medical condition? And do you have any expectation about what we are going to talk about today? Um, After exploring the idea will expectation of the patient, then you should mention uh, that he is right in what he mentioned. You have problem related to bugs in your chest, which is called pneumonia. Unfortunately, at the moment it is severe enough to lower your oxygen level and affect the blood pressure because some of these bugs um, have been reached your blood, causing condition called sepsis, which means spread of the bugs to the blood, which can affect your blood pressure, really, and after that can even affect your consciousness. Um, Actually, we are in a rather critical situation now, which necessitate close monitoring. May need certain drugs to control your blood pressure and need a close monitoring of your oxygen level and also may need some machine support for your breathing. All this cannot be done in the ward. So our consultant is suggesting transmitting you to intensive care. You get close monitoring and proper treatment in order to improve your condition. So what do you think? A patient refused or any refusal in communication, you have to ask why directly. He has a previous hard experience, so you should show empathy. There are many ways to show the empathy. I understand why you feel this way. Um, I appreciate must be hard experience that you went through um, after your loss, and I'm really sorry about what happened to your wife. You can ask him what happened exactly, or what was the situation. Um, like it sounds like ICU admission or intensive care admission become associated with loss and suffering for you rather than recovery. But and I totally understand why you feel this way. And actually, many people can think about intensive care admission the same way. But let me explain to you further. We are in a classical situation i- which need close monitoring, which cannot be afforded at the ward. Uh, can give some medication which should be given under close monitoring, and also need some devices or might need some devices which might not be or cannot be transferred to the ward. We are giving you the best treatment. Despite this, like you mentioned, your condition is deteriorating, so we have to think another option. uh, I agree with you. It is totally your right to decide. This is the autonomy to decide whether to accept or refuse transferring you to the intensive care. But before taking such decision, uh, would you allow me to make sure that you clearly got the risk and benefit of admission to the intensive care? Um, would you tell me how much you got from our conversation so far? And you have to listen to him. And if he mentioned that he appreciates, he is putting himself at risk, and this can lead even to death, and still refusing intensive care admission, here you assess his capacity. By this way, you understand, you check back that he got what you said, and he understand it, and he recall the information back to you and took decision based on balancing the benefit and risk. You know the benefit and the risk, and despite this, he refused the admission. Um, the important points that could be raised in this scenario, for example, the patient asks you if he is admitted to the intensive care, does this guarantee his survival or he is going to be cured? There is no guarantee, but it offers better care, better observation, and better options for treatment that cannot be available in the ward. But staying in the ward, making, despite trying to offer uh, all the support and care, but wouldn't be like the intensive care. And at a point, may need to the device support, which is not cannot be afforded at the ward. Um, and at this point, the patient is at risk of life-threatening complication. You should be clear in this because he is in hypoxia and sepsis. يعني the common scenario that he will go into or will need respiratory support and uh, vascular support as well. So he should understand this so well. If he accept this, you should state or tell him that you appreciate his decision, and if you decide at any time to change your mind, if the condition is still deteriorating, we are going to offer you all the medical care regarding oxygen, regarding antibiotic support, and the other available treatment that can be given in the ward. But if the situation deteriorated further and you changed your mind, we can discuss, or you can change your decision at any time. This is one point. Or other point, which is very important, to tell him how you can raise the issue of DNR in brief, not in details, because in such condition, you are if the condition deteriorated, uh, unfortunately, uh, your heart might stop. And in this condition, we are at this point that we should take the decision of resuscitation. Um, do you agree to do this or not? Because this condition, hypoxia and sepsis, will end into death, actually, if not supported by vascular support or vasopressors and possibly ventilatory support. So you should raise this in brief. خلاص. Still, you have to confirm that you respect his autonomy or his right to take decision or decide for himself. And if you want to change your mind at any time, I'll be happy to help you in this. You can offer also a consultant review by telling him if you want to have a meeting with my consultant to discuss this issue with you further. He might be more able to convince you if you change your mind. Okay? And then clues, very important in this scenario, the empathy, expressing emotions. Number two, to check the capacity of the patient and to ask him not, يعني, better, not to summarize, but to ask the patient how much you got from our conversation. What is the information that you got from our conversation? Let me assess that I clearly explained the risks of not being at, and you understand this and took your decision based on balancing the benefit and risk, which is assessing the capacity, and choose the examiner that you respect the patient autonomy. So your task in such scenario, not to convince the patient. Your success is not related to convincing the patient or insisting on your decision, but to show that you understand the issue of capacity and autonomy and show reaction to the emotions of the patient and express empathy. Clear? Any question?
Yes, Dr. Mona, I have question, sorry.
Yes, please.
Yes, in this scenario, we are speaking to the patient, yes?
Mm.
But if we speak to the relative, if the son or the
جميل.
daughter,
Yes, sir.
if the daughter of the patient speak to me and told me that I didn't want I didn't want to admit my mother to the ICU.
Perfect.
So what
will you do?
Yes, what will I do?
Let me ask you first. What will you do?
Okay. Sorry?
Let me ask you first.
Okay.
يعني حضرتك تجاوب الأول وبعدين أنا هقول.
تمام. تمام. أنا أول حاجة I will speak to the patient, to the relative that the benefit and the bad effect of admission and not admission, and I will told her if and then I will ask her why you don't want. She will told me that my husband, my father, or like that. I told her that the situation is totally different, and your mother will have benefit, and we will do our best to save your mother health. And if لو هي أصرت يعني I will escalate to the consultant that I will do.
طيب this accepted totally في السيناريو that we discussed. بس برضه مش هنescalate to the consultant. We are going to assess the capacity و emphasize on the issue of autonomy وبعدين نجيب the option of consultant interview. But in case you are talking to a relative.
Yes, and the mother is deteriorated. يعني mother need urgent admission.
Scenario, we need urgent admission. We are talking to the relative.
Yes.
First, you have to ask, are you the next of kin? And if the patient conscious, you have to ask, I assume you took permission from your dad مثلا أو Mr. فلان to talk about his condition. This is at the beginning of the scenario. طيب, you explained the benefit and risk and what is what are the needs for admission to the intensive care, and the relative is refusing. You have to ask him why. Will answer, and this is a real scenario came in the exam, إنه the mother died and you don't want, well, father was in depression after the death of his wife, and he wasn't or he didn't want to have the same fate.
بالضبط.
But there is no written advance directive. In such condition, you ask him, Did your father left any advanced directive regarding intensive care admission?
Yes.
Do you have a lasting power of attorney? طيب مفيش الاتنين, none of them is present, then you tell him in such condition, as long as your father didn't left any advanced directive and you don't have the lasting power of attorney, it is the medical team decision to decide what in the patient's best interest. Um, so, I'm sorry, out of respect to your decision, but as a medical team, we have to do what is in the best interest of your father condition. خلاص. طب why you are talking to him if you are going to do the medical team decision? Provided in the patient here is not capacitated, for example, في carbon dioxide narcosis أو not capacitated, not able to take decision. It is the medical team decision in such condition as long as patient is not able to take decision for himself, no advanced directive, no lasting power of attorney. So it is the medical team decision. These are the four decision-making powers. Patient himself, the advanced directive, lasting power of attorney, وآخر حاجة المedical team decision. If all the three, the previous three not present. Why you are talking to the relative? Just to put him in the situation, to know the progress of what is going to happen and why you took this decision. Not to be surprised that his father مثلا was transferred to the intensive care without his knowledge. But not to take his opinion as long as he doesn't have any legal authority. تمام؟
تمام. اوكي.
فايفن if he refuse, وطبعا السيناريو ده بيجي في many scenarios, يعني ICU admission, introducing device like مثلا pacemaker, like PCM, and the relative is refusing for fear, for previous hard experience, whatever the cause. At the end, if he doesn't have a legal documentation like advanced directive or lasting power of attorney, well, patient is not able to take decision for himself, it is the medical team decision. Out of respect to your opinion, it is a medical team decision, and we have to do what is in our patient best interest. Clear?
Thanks, Dr. Mo. Clear.
Thank you. Any other question?
Yes, Dr. Mona. About the issue of raising about the DNR. The patient expressed already his fear about dying in the ICU at the first of the discussion, and I already reassured him that يعني not all the ICU the patients in the ICU are going to die, and he was already afraid from dying in the ICU. So is it wise that I discuss with him the DNR at the end of the
It is very
conversation?
wise to discuss with him at this point. Why? Because he is refusing the admission, and the DNR will not be done in the ward. So in such situation, you have to mention about DNR or the need for resuscitation, because he have to, he can refuse. He has the right to refuse for this and sign do not attempt resuscitation for. Okay, but not this is the right way, and this gives you extra mark, by the way. لكن the wrong way to convert a scenario from discussing intensive care admission to do not attempt resuscitation. ما ينفعش. You shouldn't change the scenario. عشان كده I mentioned you have to briefly mention about if you refuse admission, what is expected that the condition we are going to offer you the all support and medical care, but the condition is expected to deteriorate. In such condition, we might need for resuscitation at a certain point, and you might not be able to take this decision. Do you accept this or not? ولو قال لك no, you have to offer him to sign denial. لو هو ما يعني didn't accept, يعني مثلا in a scenario a patient was having a pulmonary embolism, massive pulmonary embolism, and he has to decision of the consultant to take a thrombolysis, and he is refusing. And you try to convince him, and at the end, he told you, I'm afraid about the risk of bleeding and stroke. And you mentioned to him, in such condition, there is a risk of death. In such condition, we have to take the decision about resuscitation. Do you accept resuscitation to be done? لأنه without thrombolysis, resuscitation will not be of benefit. The patient answered at this situation, at this point, and told him, if I have arrest or you have to do resuscitation, you have to take and I'm not able to take decision, you have to talk to my wife. She has a lasting power of attorney. يعني هو اداها الباور of attorney after he is not able to take the decision. At this point, if the wife accepted to give him thrombolysis, it's your right to give him. Okay, but before this, you cannot give him thrombolysis. And in such a scenario, you have to talk about resuscitation and not attempt resuscitation. You got the point? Because the normal progress of such a condition is death, ultimate death. واحد عنده massive pulmonary embolism. What do you expect to happen if he doesn't do thrombolysis? He will die. So you have to discuss the issue of resuscitation. Okay? But don't turn the scenario into do not attempt resuscitation scenario. You just point to this in brief, in 1 minute or so.
Okay, Dr. Moy, thank you.
Thank you. Any other question?
Yes, Dr. Moy, please. لو البيشنت is not comfortable وما فيش advanced directive بس في lasting power of attorney، هل اللي معاه lasting power of attorney من حق إنه ياخد decision؟
Yes, if the patient is not capacitant or not conscious, and there is no advanced directive, and you are talking to the relative or to the lawyer or anyone taking lasting power of attorney, he has a legal document, and he told you, do not do anything in this condition, he has the right. بس خلينا هنا نقول certain issue. In life-threatening condition, and the relative have lasting, أو the other person ده have a lasting power of attorney, or in minors, minors who took decision for the minor is the parent, and the parent is refusing the treatment you offered. If it is not life-threatening issue, خلاص you follow the lasting power of attorney. If it is life-threatening issue, you have here to raise the issue to the court. والcourt ده legal يعني counsel in the hospital will give you immediate decision, just to make sure there is no hidden agenda or hidden issue in the refusal. You discuss and you declare the benefit and risks, and you try your best to show why you want to do this and how it is life-saving. If he is still refusing, خلاص, it is the decision of the parent for minor, or the person who's taking the lasting power of attorney for adult to take the decision. And in certain issue, if you have any special suspicion, you have to raise the issue to the court.
اوكي يا دكتور، بس هو معظم الكيسز هتبقى غالبا لايف ثريتنج زي ما حضرتك قلتي، مثلا بالمونري
بالظبط لو في lasting power of attorney، you have the decision, and if you have any certain suspicion, you have to raise the issue to the court. Okay, thank you. Any other questions? شكرا. أي سؤال يا دكاترة؟
شكرا جزيلا.
شكرا. طيب thank you. وإن شاء الله tomorrow at 10 برضو will be our next meeting. شكرا يا دكاترة.
شكرا دكتور.
شكرا.